Okay, the first lecture is breast anatomy. Breast anatomy is very important if you are going to study next breast surgery or if it's a part of your basic foundational sciences. So, what is breast? Breast is actually a modified skin gland because it's present on the skin and it is kind of a gland that specializes for milk production and lactation. So, anatomically, it is made of glandular tissue, ducts. There's a lots of glandular tissue, then there's ducts, then there's connective tissue, fat, blood vessels, lymphatics, and nerves. There are a whole lot of things that's going on, and we are going to discuss all of everything here. Okay, whenever we are going to discuss anatomy of any structure, first we should know where it is located, like where it is in the body, so we can study it. So its location, it is actually on the anterior thoracic wall. You can see here, this is an anterior thoracic wall. And what's its extent? It's present in the superficial fascia, and you will see here it extends from the second to the sixth rib. Vertically, if we are like this, vertically it's second to sixth rib, and horizontally from the lateral part of the sternum to the mid clavicular line, like this. This is its whole area of a breast. Same goes on the other side. And then there are some underlying muscles. This is very important because it comes in MCQs and then Viva, like what are some of the underlying muscles that's below the breast tissue. So those muscles are pec major, and you can remember this, it's major, so it's going to be majorly present beneath the breast. Then there is serratus anterior on the lateral part, like you can see here, this is a serratus anterior, and you can see it's present on the lateral part of the breast. And then there is oblique muscles here, and their epineurosis is also going to be the part of breast. Okay, then there is another structure that's called axillary tail of Spence. What is it? There is a fancy name. Whenever there is going to be some fancy name, it is going to be important clinically. So it's actually the breast tissue when it extends into the axilla like this. So this here is called tail of Spence. Okay, why it is important? Why we are going to talk about something tail? Because it is breast cancer may spread from here. That's why it's important. Axillary tail of Spence. Okay, then there are some layers that are the layers of breast, and we are going to study from superficial to deep. From superficial there is skin, obviously, like this. This is skin, and then beneath it there is some superficial fascia. Then there is going to be the breast tissue. Then there is a space that's called retromemory space, and then there is deep fascia, and then what is it? Pectoralis major muscle. This is all the breast tissue contains 6 layers, like here, skin, fascia, then hold the breast tissue, then deep fascia, then there is some space here which they didn't show it like this. You can set retromemory space, and this is pec major. Okay, structures. What are the structures of breast? There are 2 types of structure: internal, external structures and internal structures. Okay, then first of all we're going to discuss external structures. What is it? External structures, and there are 2: nipple and areola. What is nipple? Nipple is like this, a conical projection at the 4th intercostal space in male. Where is it? 1, 2, 3, 4. It's here in male. We can definitely tell in male, but it is not definite in females. It can vary. Okay, what it contains? It contains 15 to 20 lactiferous ducts. You can see 1, 2, 3, 4. They are here, but we are actually seeing a cross section. So there are lots of lactiferous ducts that are going to open in the nipple. Because why there are lots of ducts opening here? Because the milk is going to come out from here. That's why. Then there are some smooth muscles, and very important thing, another, it is highly innervated. It has lots of nerves, and that's why it is highly sensitive. So smooth muscle, there are 2 types of organization of smooth muscle: circular and longitudinal. So both there is circular and longitudinal organization. And why it's important, because it helps in suckling, and whenever there is cold, these muscles erect the nipple. In suckling, these also erect the nipple. Then there is areola. Areola, were like, what is it? You can see here I'm going to draw a nipple. It's a nipple, and then there's another whole pigmented area around the nipple is areola, and there is some like these small openings around it. Areola contains all the glands. Sebaceous glands, the gland names sebaceous gland, sweat gland, and then the Montgomery glands. That's like, oh my god, another fancy name, but Montgomery glands are modified sweat glands, so you don't need to worry. And what sweat does, it lubricates. So these do the same thing, it lubricates the nipple during suckling, so it's less painful for mother. Then there are internal structures. Internal structure contain, obviously we discussed that there is nipple and areola external, and there's lots of gland and fat and fibers are there. So let's go one by one. First of all, there is glandular structure present in internal structure. The type of glands that are present in breast tissue are tubulo-alveolar glands. Oh my god, what a name, but let's dissect it. It's a tube, and then there's alveoli at the end, so it becomes tubulo-alveolar gland. That's how these glands are. So their organization is, there are 15 to 20. First of all, there are going to be alveoli, then there's lobules, and then there are many lobules that are opening into a lobe, and that lobe is, all of those lobes are opening in the nipple, as we have seen here, and going out. That's how it is. Okay, so what's alveoli? Alveoli, you have heard the name alveoli in respiratory physiology. Okay, so it's going to be the same. Alveoli is like a sac type structure, and what it contains, it has small cuboidal epithelium like this cube shaped structure. And what its purpose? Milk. Okay, and then there's around the alveoli there are some type of cells that are myoepithelial cells. What are these are again modified smooth muscles. You don't have to worry about something else, these are just smooth muscles but with a fancy name. So these are myoepithelial, and what's their purpose here? Let's see. Alveoli, lobule, and there are some myoepithelial cells, and these are surrounding the alveoli. These are like, you can see a covering of a balloon, like there's a balloon and there's something that's covering it. Well, what's the purpose? This is a pituitary, and from the posterior pituitary oxytocin comes, and oxytocin acts on these smooth muscles, and these smooth muscles contract. Yeah, and when you push a balloon, it pushes the air out. Yeah, just in this case it's not air, it's milk. So it's contracting the myoepithelial cells. Myoepithelial cells are forcing here, and milk is going out from lobules to lobes to lactiferous sinus to nipple, like here. First we talked about alveoli, and then we're going to talk about duct system. These are all the ducts out there. And there is some milk pathway that I've already told you, but let's just see it more here. Alveoli, interlobular, pushing oxytocin, pushing alveoli, interlobular, then they are going into lactiferous ducts, and then into nipple. But there is something like here. What is it? It is called lactiferous sinus. Sinus is a space, it's like a big thing. What's the purpose of this? This all milk cannot be ejected all at the time. We need to eject it slowly. So this is going to be act as a store, a reservoir of milk. That's why it is swelled. Okay, ducts is happen and alveoli, we are done with that. Then we discussed that there is some stroma. Stroma are like the fibers. We need fibers to support the breast tissue. And what are these called? These are called suspensory ligament of Cooper, another fancy name of simple suspensory ligaments. Okay, first of all, we are going to see there is skin, and then there is epidermis and dermis and dermis. All of these suspensory ligaments are like this, and they're going into deep fascia, and in this purpose they are going to support the breast. And there's some clinical importance as well, skin dimpling, that I'm going to tell in the end. Then there's some fat tissue which is adipose, and what's its importance? It helps in size and the cushion and protection against some trauma. That's it. This is all the anatomy structure wise. Then we're going to see what's the blood supply. Okay, we have two breasts, so you can double the blood supply. Yeah, they are pretty irregular. So there are 4 types of arteries that's supplying the breast. Subclavian artery gives a branch that's named as internal thoracic. Obviously, breast lies in thorax. This is going to give branch that's internal thoracic. And as you know, the aorta is subclavian arteries. And why I am illustrating arteries in red or blue? Okay, so another breast here. Okay, what's going to is here. So which part of breast it's going to supply? Obviously, medial part. We don't want to work hard. Okay, this is intercostal space beneath the two breasts, between the two breasts. And then there is lateral thoracic. Oh my god, the name is telling itself. It's going to supply the lateral part of the breast. It's coming from the axillary artery. Axillary artery is already running on the lateral side and supplying the upper limb, axilla, and with that it supplies the breast. Okay, it also gives another branch, like thoracoacromial branch, another fancy name, but it's going to do the same purpose. It's going to supply the upper part of the breast. Okay, it's just I'm doing the same work, but I'm going to give another name to that. Then there is posterior intercostal. Thoracic aorta, that's already passing here. Thoracic aorta also gives a posterior intercostal that's going to go to the posterior side of the breast and also supplies the deep parts of the breast. Okay, this is all the artery thing. Then venous. Oh my god, obviously when we are going to give the blood, we need to get back some blood. So there comes the veins. Axillary artery, axillary vein, internal thoracic artery, intercostal thoracic arteries. Oh my god, I'm telling the name. Intercostal thoracic. Why it's intercostal? Because there are ribs. And these arteries are running between those ribs, and with running these ribs, obviously veins. These veins are running between those ribs and they drain the breast tissues as well. It's like, let's do all the work. Then there is posterior intercostal veins, and this is where it gets important. Posterior intercostal veins, but there is a fancy name here, that's Batson plexus. What is it? Bat, like a Batman, I can say it's like it has its wing like a Batman, and they're passing through the, oh my god, yeah, this is my rib vertebra. You can see it's very bad. Okay, in vertebra, all of these veins are passing, these plexus are passing like this. They're called vertebral venous plexus. And the vertebra contains spinal cord, another veins that are going into the brain. And what's going to happen here? If there is breast carcinoma, this is going into the, let's draw cancer in black. This is going to go into the plexus, and then from here to vertebra to brain. So you are spreading all the carcinoma from the breast to the brain. That's how you do that. Okay, then there's a very very important topic. If you are going to remember one thing from the breast anatomy, is going to be lymphatic drainage. Why it's important? Because we are going to see how all the breast carcinoma is going to spread all over the body, and you should know that. Lymphatic drainage, axillary, because breast tissue is present near the axilla, and then there is some axillary nodes, and those are very important because they are going to do 75% of the work. And then they divided that main work into 5 another sub people who are going to do that work. So these name of all of these 5 people or 5 nodes. First of all, it's pectoral, anterior. It is actually anterior node, but we just gave him a fancy name, pectoral. And then there is subscapular, which is actually posterior. What it's pectoral doing, it is draining the anterior thoracic, and most of the breast tissue is going here. And then subscapular is doing what? Scapula, obviously name is telling it's below the subscapula, so it's going to drain scapula. And then posterior thoracic wall. So main people, pectoral and subscapular. Then there is humeral. Obviously the arm is near the breast, and we need to drain something from there as well, so humeral is going to drain from upper limb. And then where is all of this drainage is going? It going into the central nodes. Center, that's why they are center. And from the central there is some in the apex. So from central they are going into the apical nodes. It's like there is some people who are doing below work, and then that work is going to the center, and then that work is going to apex, like an attic of a house. Okay, what's going to happen with all of the drainage that we have? In the apex of axilla, these apical nodes are present, and what they're going to do, first they are going to drain into subclavian, and from the subclavian they go into the thoracic duct, and on the right they go into the right lymphatic duct. Okay, there is some here thoracic duct on the left side, and then right lymphatic duct. So all the lymph is going to be there. Then there are some, those are called as parasternal. Parasternal means these are alongside the sternum, that's why they're called parasternal. And obviously there's location is telling that they are on the medial side of the breast, so they are going to drain medial part of the breast, like this, the thing, whatever there is, the thing that is located there, it's going to work from that, Okay, anterior part was there, the medial breast is going into here, and then there are posterior intercostal nodes. But obviously there are ribs that are working with sternum, and then these nodes are present on the heads of the ribs, and what they are going to do, they are going to drain deep posterior breast. But mainly these two, axillary nodes, parasternal nodes, and then there is some supraclavicular and infraclavicular. This is clavicle. The nodes that are above it are called supraclavicular, and those that are below it are infraclavicular. And some of the advanced lymphatic fluid is going to drain by these two. That's how you are going to drain all the lymphatic fluid. Okay, then there is nerve supply. Obviously we need to have some nerve supply to the breast, and we know the vertebrae and the breast tissue extent is from thoracic and ribs, from second rib to sixth rib, and there is some vertebra that are also T2 to T6. There's some spinal nerves coming out from those vertebrae, also from T2 to T6. So these spinal nerves also giving anterior cutaneous branches from T2 to T6. Okay, the numbers are same, 15 to 20 lactiferous duct, and T2 to T6 and 2 to 6. So anterior cutaneous branches, they are going to give the interior part and the medial part of the breast. Then the lateral cutaneous branches of the same spinal nerves, these are giving lateral branches to the lateral part of the breast. And then T2 is going, work every end and give another branch. That's called intercostobrachial, because it's going into the arm and it goes from the ribs, between the ribs. That's why it's called intercostobrachial, and it is going to supply the arm and the axilla, because we cannot leave these parts. And what's its clinical importance? If you are going to go for mastectomy in an advanced breast carcinoma, you need to take care, otherwise you will injure these nerves. Okay, there is some another controlling thing that's going here, that's called hormones. These are also help, or you can say help, obviously. Endocrine system is another brain. So all of these hormones are prolactin, oxytocin, estrogen, and progesterone. That's just a prolactin. Prolactin is important because what is the purpose of the breast tissue? It's going to produce milk. And what happens here? There's a pituitary gland and there's anterior pituitary, and from anterior pituitary the prolactin produces. Why? When does it happen? During suckling. And then there are some prolactin releasing factor that release the prolactin. And what's inhibited? Dopamine inhibit the prolactin. This is important. Okay. Then there's oxytocin. Oxytocin actually produces in hypothalamus and then stores in the posterior pituitary, because posterior pituitary doesn't want to work. That just works as a storehouse. And then posterior pituitary, the oxytocin, we have discussed this already. It goes on the myoepithelial cells surrounding the alveoli and act on those and push those and let the milk out. So that's what it's going here. It's going the milk ejection during suckling. Obviously the suckling prolactin, and then there's milk ejection. Estrogen, very familiar name. Estrogen is producing from the ovaries and placenta. And what it does, obviously when you're pregnant, your placenta is producing estrogen, and we need to have lots of ducts that going to produce milk. So it grows the duct system. And then progesterone also happens from corpus luteum and then placenta, and it also develops lobular alveolar development. Why these two are important? Corpus luteum, at the ending stage of your menstrual cycle, you can experience breast tenderness due to this culprit, the progesterone, because it's developing lobular alveolar through corpus luteum, and then during placenta, that's what it's important. That's what it's going to serve the purpose. Okay, there's some histology going on. Obviously, if there are cells there, we are going to see what's their shape and structure and everything. Two types of epithelium is there: secretory epithelium and myoepithelium. Secretory epithelium, we have discussed this in alveoli. We have simple cuboidal epithelium that's going to produce milk, so that's called secretory epithelium. And then myoepithelium, again smooth muscles that present there, they are going to do milk expulsion. And then there's type of secretion. Two types of secretion is there: protein, which is merocrine secretion, contains some fat. So lipid secretion, which is apocrine type of secretion. Okay, the very important part after lymphatic drainage, clinical anatomy of breast. What are some of the clinical scenarios that we are going to face? Most important, breast carcinoma. And what is the most common location of breast carcinoma? It's going to be upper outer quadrant, this part that's going to locate most of the carcinoma. Okay, then there is another clinical anatomy that's called peau d'orange. just remember the orange thing, because it's going to look like an orange pitted skin. And why it is? Because whenever your lymphatics are blocked, what happens when your lymphatics are blocked? It's going to cause edema. So edema cause the pitting, and then there is some hair follicles also gets increased, so that's called the pitting and giving an orange shape. Then there is something called skin dimpling, and I have told you that we are going to discuss it next. We have discussed that there is a lots of fiber going from dermis to deep fascia, and whenever these are going to retract during cancer, when there is a cancer going on, these ligaments of Cooper are going to contract, and whenever they are going to contract, they're going to pull the skin inward, and that pulling of the skin is called skin dimpling of the breast, and that shows the carcinoma has progressed. Then there is nipple retraction, again the fibrosis, whenever the breast carcinoma, cancer, and then there is some trauma as well, and after the trauma there is fibrosis has happened. The fibrosis is going to retract the nipple inward and shortening of the breast. That's what nipple retraction. And mastitis you can remember that it's an inflammation. So it is actually inflammation of the breast tissue. Why it happens? It happens during lactation. There is a bacterial infection going on, that's called mastitis, and most important bacteria that does this is Staph aureus, because it's present on our skin. Gynecomastia, it is most of the you will see in gynec, if the male person is going to develop like female breast, that's what called gynecomastia. When your hormonals are imbalanced, or you're going to having some liver disease going on, or you are on some drugs, or it's your puberty, that can also do gynecomastia, but this is more like a physiological, others are abnormal. Okay, this is all we have discussed from breast anatomy.